Hey guys, and welcome to today's video about chronic obstructive pulmonary disease, or COPD in short. COPD is a combination of chronic bronchitis and emphysema. Chronic bronchitis is when the bronchioles or airways become inflamed due to persistent damage by either smoking cigarettes, inhaling air pollution, dust, or irritants. Emphysema is when there's lung tissue damage at the alveoli or air sacs, reducing the gaseous exchange between oxygen and carbon dioxide. Many people with COPD present with both conditions but at different ratios, so one patient may have more emphysema than chronic bronchitis or vice versa. Unfortunately, it is generally not diagnosed until irreversible damage has occurred, because that's when the symptoms start to become problematic and affect their quality of life. There is now evidence that COPD is not only associated with airflow obstruction, but it is also present with comorbidities such as skeletal muscle dysfunction, cardiovascular disease, osteoporosis, and diabetes. This led to the production of an internationally known definition for COPD by the Global Initiative for Obstructive Lung Disease, or GOLD. Chronic obstructive pulmonary disease is a preventable and treatable disease with some significant extrapulmonary effects that may contribute to the severity in individual patients. Its pulmonary component is characterized by airflow limitation that is not fully reversible. This is usually progressive of the lung due to noxious particles or gases. As a consequence, patients with COPD have impaired exercise tolerance and reduced activity, which contribute to a reduced quality of life. There are three important things that we can take from that. The first being that there are factors outside of the lung which contribute to COPD. The second, which states that COPD is not fully reversible. The third, which states that the effects of COPD cause people to have a reduced quality of life. So the symptoms of COPD include breathlessness on exertion. Breathlessness can be graded using the Medical Research Council's dyspnea scale. It is either graded at 1, 2, 3, 4 or 5. 1 being no trouble at all with exercise except when strenuous, all the way to 5, which is too breathless to leave the house or too breathless to get washed and dressed. You may notice pursed lip breathing, which is when they bring their lips together and form a little circle in their mouth just to help them regain control of their breathing. It may look like this. You may also see them making use of their accessory muscles around the neck and shoulder. For example, their shoulders raise to increase the lung capacity to be able to inhale as much air in as possible, and also making use of their abdominal muscles a lot more to expel air out with greater force than usual. You may also notice a chronic cough and regular sputum production. Now, coughs generally occur when you're attempting to remove a foreign substance from inside the lung because it's struggling to actually travel up and out. The final thing you may notice is wheezing. Now, this generally occurs due to the narrowing of bronchioles or the airways. The simplest way to diagnose COPD is spirometry. Spirometry is when you blow into an instrument long and hard to give us three important values. FEV1, which is the volume of air the person is able to expel in the first second of forced exhalation. FVC, which is the total volume of air the person is able to forcibly exhale in one breath. And the last one is the FEV1 FVC, which is the ratio expressed as a percentage. COPD is diagnosed when the FEV1 predicted value is less than 80% and the FEV1 FVC ratio is less than 70%. It's important to note that the predicted value may be lower in those that are non-Caucasian. People with asthma may present with similar values, however they'll require further questioning and testing to differentiate between COPD and asthma. So why does COPD occur? COPD develops as an inflammatory response to harmful substances. For you to understand this simply, I'm going to explain the cause of air trapping, emphysema, and narrowing of the airways, chronic bronchitis. Air trapping. Inhaling harmful substances causes inflammatory cells to accumulate, initiating the inflammatory mediators. This can cause damage to the elastic tissue in the alveoli, resulting in a reduction in airflow and gaseous exchange. Narrowing of the airway occurs due to damage by harmful substances to the lining of the airway. Thereafter, inflammation occurs which immobilizes the cilia. the net result being the characteristic cough of COPD attempting to clear the buildup of mucus in the lungs. So that's it for today, people. Some of the information provided today can be found in the NICE guidelines for COPD. There's a link in the description box. If you feel you have any questions or ideas for future videos, please leave a comment down below. Other than that, subscribe to follow for more content. Take care, and I'll see you later.